I'm going to talk about something completely different a little bit. I'm going to talk about what are the IOC doing to help the health of the athletes that we have. How can we keep them healthy? You saw all those nice videos that Dr. Granjero was showing you. We see those injuries very often. And actually, so this is what I'm going to talk about. My background is a little bit, yeah, good, it works, yeah. So I'll just give you my background. I'm an orthopedic surgeon. I work about half-time in Switzerland for the IOC and about half-time in Oslo in Norway, where we just had snow, by the way, the other day, so it's nice to be here. Since 2007, I've been the head of the IOC scientific activities in sports medicine, and my job was to do what you see here. It's a big job to develop the IOC into becoming a force in the area of sports science, sports medicine. And I'm working with the former president, former chairman, so you can see that here. And this is now the new head of sports medicine in the IOC, Richard Budgett, former Olympic gold medal winner in 1984 in rowing. And this is how it looks like today. And this is Ugur Erdener, professor in ophthalmology from Turkey. He is the chairman of the medical commission of the IOC. This is a picture of Jacques Rogge. He wrote an editorial in 2009 and said that through the initiatives that the IOC would do, we aim to protect the health of the athletes. And now we know we have a new president, Thomas Bach, and he's actually saying the same thing. This is a very important part of the IOC organization. And these are some of the projects that I am doing here in the IOC. I'll go through a few of them. I'll show you also some of the injuries that we have during the Olympic Games. So in 2008, we appointed 4 research centers around the world: Melbourne, Calgary, Oslo, and South Africa. And they are paid by the IOC in a grant to do research such as this. But basically, you don't have to read this, because this is what they do. They're supposed to do science to protect the health of the athlete. Not only injuries, but also illnesses as well. And we publish this in the journal, or British Journal of Sports Medicine, which is run by the IOC 4 times a year. There are 22 issues a year. IOC publishes 4 out of those, and you can see here that the downloads are quite high. So they have a big impact in sports medicine. We just have had a new application out for new research centers. We're going to, this week actually, you'll hear that there are 9 centers appointed for 4 years around the world, or all corners of the world. So this is what they have to do, and this is what they get from the IOC. Not very much money, 100,000 Swiss francs a year, but it's a free type of grant. This journal, British Journal of Sports Medicine, you may not read it so much here. It's a very good journal. It's number 4 of all the sports medicine journals in the world, and it has a very high impact factor for a sports journal, 4.1. And this publishes all the research we have on prevention of injuries and illnesses. And this is the 2014. You can see here that we've gone through several things there. And now in January 2015, we're going to have all the data from Sochi, for example, all the injuries and all the illnesses up there. In addition to this, we run conferences, of course. We run every 3rd year the IOC World Conference on Prevention of Injury and Illness in Sport around the world. It's coming up in 2017. And then every year now we run something called Advanced Team Physician Course. This is a course for doctors like yourself who are involved with national Olympic committees, international federations, or in the Olympic teams for Brazil, for example. It's 100 participants every year, and we do this once a year around the world. This is, we're going to do it in Doha, in Qatar, in May 2015. Last year we were in France, outside France. How can we help you? Well, the Olympic Solidarity, which is part of the IOC, has a relatively large budget. And you can apply through your National Olympic Committee for support for your research or educational activities. Let me show you here that I'm going to show you 4 activities that you can apply for. So if you're going to do research, you're going to do sports medicine courses, or you want to send your fellows or residents to a world conference, or you want to do something else that has to do with prevention, you can apply through your National Olympic Committee, in this case through Brazil, and the IOC will actually give you some money to run your courses and send your residents out. And you can see here we are spread around the world, and as much in the Americas as we are in Europe, for example. We do publish books every year. I know that books are not so, the young people now, they don't read books anymore. They're all on the internet or in the web. So all these books are now also on the web, so you can buy it there, and it's cheaper than to buy a whole book. But these are the medical handbooks. This year we came out with the female athlete and in gymnastics. And this is the Encyclopaedia, which is a bigger book on special issues. This year we came out with sports nutrition, and there's 1 book a year. This book came out just before the Olympic Games in London. This is the IOC Manual of Sports Injuries. And for those of you who are residents, I would say that this is a pretty good book if you are working with these kind of athletes. Now in 2015, in January, we have a book coming out on emergency medical care in sports, which is of course becoming more and more important, not only with injuries, but also with cardiac arrest and things like that, for example. The one thing that we do twice a year, we have 20 experts from around the world coming to Lausanne in Switzerland, to the IOC Center. And they work for 3 days on an issue that is very important for the IOC. So for example, we just did one on youth athletic development. How to train the youngsters without getting stress fractures or getting fatigued and so forth. How much training can you do? How much competition can you do? And this is something we publish in British Journal of Sports Medicine. So for example, the one on concussions, which is a major issue in many countries. I know that not so much in Brazil, even though there was a big issue in the World Cup with this injured player who came back to the field, and this is going to change the rules in football probably, that the doctor probably can overrule the coach or the player if he wants to get back in after an injury like that. So this was published in BJSM, the so-called SCAT forum. That's a short forum on how to handle issues like this on the sideline and in the dressing room right after or in the intermission. So these are important issues that if you're into this field, you should look into. We also published the screening methods for high-level athletes. This has been published in 7 journals around the world. And why are we doing this? This is to protect the athletes. So when they come to the Olympic Games, they will bring their screening form with them, so we know if they have any problems, and if they then get sick or injured during the Games, we can better handle it. And I guess that I want to pinpoint this because the sudden cardiac death is still an issue, even though we haven't had a sudden cardiac death in the Olympics since 1960. But this is something that happens everywhere around the world, and we need to be able to prevent it, or if it happens, do something with it. And I have sort of first-hand experience in this. This is a Norwegian swimmer who was a gold medal favorite before London, and then in training camp in the US in May before the Olympic Games, he had a sudden cardiac death and died. And of course, this is something that is really, really high on our agenda, to be able to do research that can actually pinpoint who are at risk for having something like that. Therefore, during the Games in London and now in Rio, we will run courses for the doctors and physios. Every day there will be a symposium or a seminar. In this case, this was on cardiology, and we will run that on a daily basis in the games here in the Olympic Village. So those of you who are going to be doctors for your teams, you should participate, take part in that. We also run every year 2 courses on cardiology, on how to detect people that are at risk for having sudden cardiac death. You can now, with the current technology, probably prevent about 50% of the sudden cardiac death, but we're not able to prevent 100% yet. That's something that we need to work harder on. And we just finished a course in Qatar with cardiologists from around the world on this issue. I want to show you a little bit about what happens during the games, actually. And this is Beijing. This is the Bird's Nest 2008 Olympics. This is the research group that we have that are doing surveillance of injuries and illnesses during the games. And in Beijing, we have 12,000 athletes, about 1,000 injuries, so it's pretty high. Half of them were time loss injuries, so they were pretty serious. Now, that was Summer Olympics. Here is Winter Olympics. This is Vancouver, 4 years or 2 years later. And here you can see that there are only 3,000 athletes, but there still is about 12% injuries of those athletes and about 7% illnesses in them. And I'm going to show you a few things. So this is, for example, snowboard cross. You may have seen that on TV. It is a very risky sport. And in this case, in Vancouver, every 3rd patient had an injury. Every 3rd athlete had an injury in that sport. And this is even worse because I think I'll get to that afterwards, but in Vancouver, there were head, knee, and concussions. The most important things. That's what you need to know about. But look at this. 70% of girls, women doing snowboard cross, injure themselves. So when that happens, there is something wrong with that sport. We have to do something. We have to change the rules, the venues, and the equipment, and the training they do. How about London? What was it like in London? Well, London was very peaceful in many ways. It's not a peaceful city, but it was very peaceful. Hopefully Rio will be like that in 2016. If you look, I know this is a bad slide, very small, but you can compare Beijing and Vancouver here. You can see the differences in injuries. But rather look at this one. Here you can pick out your sport. You can look at the percentage of injuries and how many of them are serious. You can see there are some sports, taekwondo, snowboard, and so forth, that are very dangerous sports here. And those are the sports that we pinpoint to try to do preventive research in those areas. And look at this. This is Beijing, Vancouver, and London. The blue is injuries, the green is illnesses. And there's a slight, although statistically not significant, increase in injuries every time. That could be, of course, because we are getting better at detecting them. We have better equipment, more MRIs, and so forth than before. But this is something that is a little bit concerning. And when this happens, we publish everything in British Journal of Sports Medicine, so many of you have probably read it already. How about Sochi? Sochi was very different. Sochi is a small town, tiny town in the Black Sea, in the southern part of Russia. And they have no snow down by the Black Sea, but lots of snow up in the mountains. This is the research group, and this is the medical commission there. And this is Putin. What was he doing there? Well, the only serious injury in Sochi happened to a Russian downhill skier. She had a subluxation fracture of her lumbar spine and became quadriplegic, actually, and she is still that. And there was a small local hospital up in the mountains in Sochi, and they actually did surgery on her the first night, and then she was moved to Munich. But then before she was moved, Putin came by and said hi to her. And Putin was actually every day he went to the games. So he was very proud of Russia. But I was there when Russia lost to the US in hockey, and he left before the game was over. So he's a keen Russian patriot, I should say that. But it was nice of him to come and visit her. I'm just going to show you this. So in aerials are skiing, you know, where they jump up, acrobatics, 40% injured. Slopestyle, 32%. Snowboard cross, 40% of the athletes were injured. Those three sports are quite dangerous, and we have to do something about it, and we are working on that. Look at this one. It's Beijing, London, Vancouver, Sochi. And just look at the last line on more than 28 days. That means that the injury is serious. You're gone for a long period of time. And while we had in London, Beijing, and Vancouver only about 5%, here we are up, here we have doubled to 10%. So there were more serious injuries in Sochi than it has been before. And that, of course, is a concern. Finally, I want to talk about two other things that you may participate in. We started last year something called the IOC Diploma in Sports Medicine. It's a web-based course, 2-year course, and you can do it even if you have a full-time job. You can do this on evenings, Saturday and Sundays. And it's a tough course for Olympic doctors, or for NOC and IF, International Federation Doctors. 2-year program, you can see that here yourself. And there's a workshop at the end of those 2 years, and we're now in the 2nd year of the first group, and we're going to have a workshop in May on this. And it looks like this if you go into the website, and you can find all the lectures and stuff like that. And that's maybe something that you might be interested in. English is required. You have to have that. So if you don't have English as your first language, you have to have some sort of a test that proves that you are able to read and study English. And this new thing here is going to be one for physiotherapists too, and trainers in the US. Similar thing starting next year. Then I want to give you something. After this sort of long talk, I want to give you something. And if you have your iPhone here, you can look at App Store, and then you can download something that I'll show you. Because we have made this last summer something called an app, something called Get Set. What is that? It's evidence-based knowledge on how to prevent and how to train after an injury, various kinds of problems. You can download it from App Store for free, and it looks like this. So if you, for example, are doing basketball, you can click on basketball, you get the most usual injuries, and then you can get rehab or prehab programs for those injuries. Videos, it's very nice to use. I use it in my clinic. I show it to my patients, they download it, and they have the videos there. So here you see, if you play basketball and you have a shoulder problem, you can click on shoulder, and then you can get the videos on how to pre or rehab your shoulders. This is free. App Store is called Get Set, and it's financed by the IOC. Looks like this, full screen option, looks like this. So this is something you should do if you're interested in this. Finally, I want to pitch for volunteers to come to Rio next year. You know, it's something I'd like to tell you that I've been to very many Olympic Games, and the one thing that I take it from them is that the volunteers all have had a great time. They work pretty hard, but they meet people from around the world and they have lots of fun. So Dr. Grangero has already told you that we need lots of specialists in Rio for that time. And you can be part of the Paralympics or the regular Olympics or both of them. There are so many test events and there are so many events that there is more than enough to cover. So I would say to you that this is something I will really strongly tell you to do, and you can do this by looking at this website here. If you go into that website, you can sign up as a volunteer. You can do that even if you live in Denmark or if you live in Afghanistan. You don't have to live in Brazil even, and you don't have to live in Rio, of course. Something I would strongly recommend you to do if you are a young and able to travel around the world. This is something that would be fun for you. Finally, this last slide, I want to show you something. I always compare sports medicine, injury prevention, to climbing a Norwegian mountain. You know, we have lots of mountains in Norway, and this is a mountain I like. And you can see me up there climbing almost on the top. And there I get to the top. I can look at the fjords of Norway, which are very nice, of course. And I'm pretty happy getting up there. And then I'm sitting on the top. And I'm very happy to have managed to get up there. Then I realize, I look around me, there are so many other mountaintops that I haven't been to, that I have to also get up to. That's the same in sports medicine. So even if we have results on some stuff, we know some stuff. There's so many things we don't know. That's why research in this area is so important. Thank you.